Check Your Health is brought to you in part by Intermountain Healthcare and the Utah Department of Health.
Welcome back. We have Dr. Phoebe Freer here. She's a breast cancer radiologist with Huntsman Cancer, and thanks so much for coming in.
Thanks for having me.
And we have those new recommendations come out just last week
Yes.
about breast cancer
Yes.
screenings. I think it's confusing and it makes people less likely to go get a mammogram. What's going on?
I'm so glad that you said that, Mary, because that is my concern too, is that women may be more confused. I think they were trying to clarify where the strongest evidence for mammography was, and in doing so, really confused women. I think the important thing to remember is that they allow the option to continue annual screening starting at 40 and continuing every single year until you're elderly or otherwise have some other life-threatening illness. And I think that that is the most important thing to remember, is that they recognize that doing an annual mammogram 40 and above, even in women of low or average risk, saves the most lives, and that's where the largest benefit is.
So don't let it confuse you.
Right.
The 45 to 54 and all that kind of stuff. Talk to your doctor about it.
Talk to your doctor. You know, they were attempting to minimize the risks of being called back for additional imaging, and that is a time of anxiety for women, but most women would be willing to undergo a few extra pictures and a wait to get those few extra pictures to decide that they don't have cancer in order to save their life from breast cancer.
Right, and I'm waiting I think it's a little anxiety, and I would rather have a little anxiety than a tumor growing.
I think that's exactly how most women would feel.
And the earlier it's detected, the more likely it is to be cured.
Yes, it is well established that the earlier cancer is detected, the better the prognosis, the better the patient does, and not even in terms of life-saving benefit, but even in terms of how extensive of a surgery a woman may need or whether or not she needs chemotherapy.
Catch it early. Okay, and 75% of women don't have family history. 75% of breast cancers
Yes, that is
from
a
no family
very
history.
important point.
Yes.
75% of the women who get breast cancer have absolutely no risk factors except for being a woman in the United States.
Right.
So,
get
screening
screened.
based on high risk does not make sense.
Okay.
So.
Coming. Nope, I'm getting mine today.
Okay.
Thanks
Wonderful.
so much for coming
Thanks, Mary.
in.
Thanks for having me.
All right, Chase, over to you for